Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Nissen Fundoplication. Introduction. Gastro-Esophageal reflux disease, also called GERD, is a common condition that affects millions of people. Its main symptoms are heartburn, a burning sensation in the chest, and occasionally a bitter taste in the mouth. Your healthcare provider may recommend a surgery called Nissen Fundoplication to treat GERD. The decision to have surgery is yours. This program will help you understand what GERD is and how it can be treated surgically. It discusses the causes, symptoms, and complications of GERD. It also talks about treatment options and the benefits and risks of the Nissen Fundoplication procedure. Anatomy. After swallowing, food goes through a long tube called the esophagus to the stomach. In the stomach, acids start breaking down the food. This process is known as digestion. Acids, or gastric juices, usually stay in the stomach. They are blocked from going up into the esophagus by a valve mechanism. The valve mechanism is made of two muscles that help prevent the backflow, or reflux, of the stomach content and juices into the esophagus. The first muscle is found in the area that separates the esophagus from the stomach. This area is called the Gastro-Esophageal junction. It is also known as the lower esophageal sphincter, or LES. This muscle allows food to go into the stomach, but not back into the esophagus. The second muscle is the diaphragm. The diaphragm is a large muscle that separates the lungs from the abdomen and helps with breathing. The esophagus goes through a hole in the diaphragm into the stomach. This hole is called the hiatus. The hiatus also helps prevent the backflow of juices from the stomach into the esophagus. Gastric juices can go back into the esophagus and cause heartburn if the valve mechanism muscles do not function properly. This is known as gastro-esophageal reflux. The lining of the stomach is made up of cells that can tolerate acids. The esophagus lining is unable to tolerate these digestive acids. The upper part of the stomach is called the fundus. The term fundoplication means wrapping the upper part of the stomach. GERD. Sometimes the valve mechanism that stops digested food in the stomach from flowing back up into the esophagus does not work right. This causes acid juices to go up into the esophagus and sometimes all the way to the mouth. This acid can irritate, destroy, and scar the lining of the esophagus. From the mouth area, the acid juices can flow into the lungs. The effects of the acid juices on the esophagus, mouth, and lungs are what cause the symptoms of GERD. The main cause of GERD is the weakness of the LES, the lower esophageal sphincter. Certain substances that can cause this weakness include caffeine, nicotine, alcohol, chemicals found in chocolate. GERD can be caused or worsened by foods such as citrus fruits, fatty and fried foods, garlic and onions, mint flavorings. Other foods that can cause or worsen GERD include spicy foods, tomato-based foods like spaghetti sauce, chili, and pizza, vinegar. Being overweight can increase your risk of GERD. Pregnancy can also cause GERD. Other medical conditions such as hiatal hernias increase the chances of GERD. Hiatal hernias cause the junction between the esophagus and the stomach to be above the level of the diaphragm. In hiatal hernias, the diaphragm is unable to help prevent reflux. GERD typically causes heartburn. If the juices from the stomach reach the mouth, they can also cause a bitter and acidic taste. Severe middle back pain can also be caused by GERD. The back pain can be similar to the symptoms of a heart attack. Symptoms of GERD are usually worse when the patient lies down. Lying down allows more juices to flow back from the stomach into the esophagus. Some patients may have coughing spells when they lie down. This is caused by acid juices flowing back up the esophagus, then down into the lungs through the breathing tube. Coughing can help expel gastric juices from the lungs. To restrict the flow of juices back to the mouth, patients with GERD may want to try sleeping with their heads up or even on an incline. Placing a block under the head of your bed so that it is slightly elevated may help. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Complications. If not treated, complications of GERD include inflammation of the esophagus, stomach ulcers, and an increased risk of esophageal cancer. Scarring that may narrow the esophagus can also happen. This is known as esophageal strictures. Esophageal strictures make it hard to swallow. Severe GERD can cause chronic inflammation of the lungs, painful esophageal spasms, and breathing problems. Treatment options. The first treatment option for GERD usually includes some lifestyle changes. Lifestyle changes include limiting the following items that can cause and worsen the symptoms of GERD: alcohol, caffeine, carbonated drinks, chocolate, smoking. Limiting the following items can also help prevent GERD symptoms: citrus fruits, fatty or spicy food, mint, onions, tomatoes and their byproducts. Sleeping with 1 or 2 pillows may also be tried. Propping up the head of the bed about 8 inches with wooden blocks may help. For overweight patients, losing weight can sometimes help reduce the symptoms of GERD. Not wearing tight clothes or belts and avoiding unnecessary bending can also decrease the symptoms caused by GERD. Another treatment includes slowly eating small amounts of food. Eating large amounts of food too quickly increases the pressure inside the stomach and worsens the symptoms of GERD. Avoiding lying down after a meal may give the stomach enough time to empty. This can decrease some symptoms of GERD. If symptoms of GERD still happen after you try these lifestyle changes, medication may be recommended. The medication may help decrease the acidity of the stomach or strengthen the LES. Some of the medications used to treat GERD can have side effects. It is important to tell your healthcare provider or pharmacist about any medical conditions you have had and any medications you are currently taking. Surgery may be recommended if non-surgical treatments are not successful. A surgery called fundoplication consists of wrapping part of the stomach around the gastro-esophageal junction. Other surgical techniques aim at strengthening the LES, such as the barred endocinch system. Another surgery creates small cuts on the LES that end up scarring and strengthening the LES. This is known as the stretta system. Another procedure places a ring of small magnets called the links system around the gastro-esophageal junction. These magnets allow food to pass through, but they don't let acid come back up. Procedure. There are 2 ways to do Nissen fundoplication. One method is called open fundoplication, and it uses a big skin incision. The other method is done with scopes and smaller incisions. It is known as laparoscopic-fundoplication. The benefits of the laparoscopic operation are a faster recovery period and shorter stay in the healthcare facility. Unfortunately, not everybody is a candidate for laparoscopic surgery. For example, Patients who have had previous surgeries in their abdomen may not be able to have this procedure. Sometimes the surgeon can start a laparoscopic operation and end up having to switch to an open surgery. This is usually done if the surgeon realizes that the open surgery is safer for the patient. Switching from laparoscopic to an open operation rarely happens. The laparoscopic and open surgeries are performed under general anesthesia. This means you will be asleep during the operation. In the open surgery, the surgeon makes an incision in the upper abdomen. The peritoneum or abdominal cavity is then entered. The stomach is then freed and wrapped around the lower part of the esophagus. The wrapping of the stomach around the esophagus prevents the reflux. With the laparoscopic operation, the abdominal cavity is filled with a special gas. Multiple small incisions are then made. Scopes are inserted in the abdominal cavity and the stomach is freed and wrapped around the lower part of the esophagus. The wrapping of the stomach around the esophagus prevents the reflux. Risks and complications. Nissen Fundoplication is safe, but there are possible risks and complications. These are not likely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. All surgeries carry the risk of a reaction to anesthesia. Most healthy people do not have any problems with anesthesia. Some people have mild and temporary symptoms, but anesthesia is safe. Risks of anesthesia include cut lips and chipped teeth, headache, nausea or vomiting, problems urinating, sore throat. Other serious risks of general anesthesia include heart attacks, lung infections, strokes. Your anesthesiologist will discuss these risks with you and ask if you are allergic to certain medications. Blood clots in the legs can happen due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs. There they will cause shortness of breath, chest pain, and possibly death. Let your healthcare provider know right away if you experience symptoms of a blood clot. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery and walking may help decrease the risk of this complication. Other risks are seen in any type of surgery. These include 1. Infection. Infection may be at the skin level or deeper in the tissue. Deep infections may happen. Treating deep infections may require long-term antibiotics and surgery. 2. Bleeding, either during or after the operation. 3. A skin scar. Other risks and complications are related specifically to this surgery. These are rare, but it is important to know about them. Structures in the abdomen or chest could be damaged. Damage could happen to the lungs, stomach, esophagus, intestines. Surgery could also damage the following structures in the body: liver, spleen, kidneys. Damage to these structures could lead to permanent damage and the need for other operations, but this is rare. Death may result from these complications, but this is also rare. Hernias through the incisions are possible. This happens if the internal wall of the abdomen is weak and the intestines push under the skin. Another operation may be needed to treat a hernia. The wrapping of the esophagus may become undone and the operation may need to be repeated. After surgery, swelling around the surgical area may temporarily make it hard to swallow. This usually gets better with time and with a soft diet. Rarely, the wrapping is too tight. This can cause swallowing problems known as dysphagia. Another operation may be needed to loosen up the wrapping. After surgery. Patients who have laparoscopic surgery typically spend 1 to 3 days at the healthcare facility. Those who have open surgery may spend 2 to 6 days at the healthcare facility after surgery. You may have a tube leading from your nose to your stomach when you wake up from surgery. After the tube is removed, your diet will be restricted to liquids for the first day. You will then have a soft diet for several weeks after surgery. For about 2 weeks after your surgery, you will need to take an acid-reducing medication. This operation may cause patients to swallow more air as they eat. The swallowed air is usually belched or burped, but some patients may not be able to release the swallowed air. This leads to stomach and abdominal bloating that can last 2 to 3 hours. A soft diet should help prevent this symptom. You need to schedule a follow-up appointment with your healthcare provider 1 to 2 weeks after leaving the healthcare facility. During the follow-up visit, the healthcare provider will examine you, determine your progress, and answer your questions. How fast you will be able to go back to work depends on your medical condition and type of surgery. With laparoscopic surgery, you may be able to go back to work in 2 to 3 weeks. If you have open surgery, it may take 4 weeks or more for you to be able to go back to work.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Gastro-esophageal reflux disease, also called GERD, is a common condition that affects millions of people. Its main symptoms are heartburn, a burning sensation in the chest, and occasionally a bitter taste in the mouth. Your healthcare provider may recommend a surgery called Nissen Fundoplication to treat GERD. The decision to have surgery is yours. Sometimes the valve mechanism that stops digested food in the stomach from flowing back up into the esophagus does not work right. This causes acid juices to go up into the esophagus and sometimes all the way to the mouth. This acid can irritate, destroy, and scar the lining of the esophagus. If not treated, complications of GERD include inflammation of the esophagus, stomach ulcers, and an increased risk of esophageal cancer. The first treatment option for GERD usually includes some lifestyle changes. If lifestyle changes do not treat symptoms of GERD, medications or surgery may be recommended. A surgery called Nissen Fundoplication consists of wrapping part of the stomach around the Gastro-Esophageal junction. This helps to prevent GERD. There are 2 ways to do Nissen Fundoplication. One method is called open fundoplication, and it uses a big skin incision. The other method is done with scopes and smaller incisions. It is known as laparoscopic-fundoplication. Nissen Fundoplication is safe, but there are possible risks and complications. These are not likely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. Thank you for using Explain.